So the pharmacists have a great role to play with immunotherapy. Obviously, we've been very used to treating patients with immunotherapy within the trial setting, but now that treatments are moving out into standard practice, standard treatment, there are a lot of clinicians that perhaps don't have the experience of using immunotherapy agents. One of the biggest challenges for us is that the toxicity profile of immunotherapy is quite different to that of chemotherapy, and there's quite a big education piece that we need to do with a lot of the oncology nurses in the community, the acute oncology teams in the community, the acute admitting teams, so the doctors and nurses in accident and emergency, so that they're familiar with some of the potential toxicities of immunotherapy that need to be managed quite quickly to make sure that we get on top of them and they don't become something that is a problem for us in treatment. So there's quite a big education piece that pharmacists are involved in doing, also educating the patients. So we do have to spend quite a bit of time, as we always do even with chemotherapy, saying if there's problems, get in contact with us, but actually being quite specific about the type of problems that they might run into with immunotherapy and why they do need to be in contact with us and not their GP if they start to run into those sorts of problems. One of the other really big challenges for us with immunotherapy is it changes the way we deliver our service. So previously patients would have often 4 cycles of platinum-based chemotherapy for first-line treatment, or perhaps 4 cycles of second-line chemotherapy, 3 months of treatment. They'd be up at the chemotherapy suite once every 2 or 3 weeks, and then that would be it. They would be back to outpatient review. With immunotherapy, that's completely different. So we have patients that are on treatment every 2 or 3 weeks, often until disease progression. So that may have a very big impact for ourselves within the clinic, for the nurses on the chemotherapy suite in terms of the capacity, and also for pharmacy where they're having to provide a much more drug than they would have been doing in the making up of that treatment. So it's having very large impact across the whole of the oncology service, and we're having to look at how we address that. Are there more modern ways of managing our service for patients that are established on treatment? Can we deliver those treatments through different means, perhaps through nurse assessment, in follow-up clinics, and only coming back to the medical clinic when they need to have scan results? Obviously having non-medical prescribers and some of those review appointments. So there's all sorts of things that we're having to bring into thinking about how we're going to effectively manage those patients when there's a lot more demand in our service.